The fingertip is defined as the structures distal to the creases at the distal interphalangeal joint. Injuries to the fingertip are generally regarded as those distal to the insertion of the flexor and extensor tendons at the base of the distal phalanx. Fingertip injuries are the most common form of hand injuries. This picture depicts the anatomy of the fingertip, where we can see the base of the nail, dunula. Sidewise we can see peroneitium, below peroneitium is there. Significance of the fingertip. For the deaf and mute, it supplants their ears and voices, and for the blind, it becomes their eyes. The underlying papillary dermis create a unique pattern of grooves and ridges that identify each individual, and that we use as fingerprint. The modes of fingertip injuries that we see are crash injury by heavy machinery, sugarcane machine, sharp cut injuries by knife, pressure, injury by bite chain. We got injuries like human bite and after using fish bone. Techniques of reconstruction for fingertip injuries, generally we follow the ladder of reconstruction. From the simpler procedures, we go higher to complex procedures if required in severe cases. Data analysis. This retrospective analysis includes 59 fingertip injury cases which are observed in last 6 months in our department. We can see 73% cases are male and only 27% female. The male are mostly industrial workers and they are victim of work-related mishaps. Females are predominantly having kitchen and household injuries. Pediatric cases are less. It is comprising only 15% of the total cases and mostly due to door crush injuries. Here we can see only left hand is mostly involved than the right hand. Occupation-wise, the mechanic being the most common form of occupation, and most of the people are unemployed in our observation. We can see 31% cases multiple fingers are involved, and in 69% cases only a single finger is involved. Among the mode of injury, crash injury being the most common form of injury, then comes sharp cut injury, which is comprising 32% cases. We have 2 cases of human bite injury and 2 bite chain injuries. The goals and principles of fingertip reconstruction: to maintain the length of the digit as well as to provide a well-bedded, stable, sensate yet pain-free skin. To maintain the cosmesis, the cover should be durable, healing time should be minimized, and the hand should return to the pre-injury functional status. Among the procedures, the skin grafting being the most common procedures that have been done in 42% cases. We got complications like in primary closure, we got wound dehiscence in 1 case, total loss of the graft. After skin grafting in 2 cases, marginal necrosis in 1 case, and the results are almost good. In this picture, we can see the type of injury is very minor. So we can do non-operative type of management. We can expect for healing by secondary intention. This is the case of right index fingertip injury, where we can expect healing by secondary intention as the severity of the injury is very minimal. Left fingertip injury, which we can manage by primary suturing with polypropylene suture material. In this case, we can see door crush injury in a child. We did KY fixation of the terminal phalanx, and the rest of the wound is managed secondarily by regular dressing. We got 1 case of human bite, where we did full thickness skin graft. On the left hand side, we can see pre-operative photo, and on the right hand side, we can see full thickness skin graft that was applied from the distal amputated stump. This is a POD40 photo that we can see the graft is localized well, it is well bedded and sensate, and cosmetically also better. This is a full thickness skin graft photo over the right middle and right ring finger tip. This is a 1 month follow-up case. You can see the wound is healing properly after 1 month. Left thumb injury, left thumb tip injury case, which was managed by atassar volar VY flapplasty. And another right middle finger tip injury that we got, which was managed by VY flapplasty on the volar aspect, like we can see in this picture. VY flapplasty was done earlier, and on 6 months follow-up, we can see the finger is cosmetically better, sensation is properly intact, and cosmetically better. And in cases where not only the fingertip but also the part of the proximal phalanx and base of the fingers are involved, we can use distant flaps like rowing flap coverage of the row area, and reconstruction of the fingers are done by this rowing flap. The fingertip injuries are extremely common in our society. The fingertip resurfacing is a challenging reconstructive problem as the treatment varies widely and thus the treatment protocol is controversial. Timely intervention is required to minimize the morbidity. These are some of the references that I have used to prepare my presentation. Thank you.
Thank you, Dr. Subrata, for giving time. The topic is open for discussion. In your slide, you said the left finger is more affected than the right.
In 32% cases, we have seen left finger being involved, but in 27, not percent, sir, 27 cases,
But
we saw.
which is more. So can you give some explanation? Because the point is that we use our right finger, we are majority are right-handed. So we expect the right hand to be injured. So, but it is not the case. So can you give some reasoning behind this
Like mechanics in construction workers, if we use some heavy machinery by right hand, we may injure our left hand by some hammer or any heavy machinery. Because we are holding some objects with our left hand and we are working with our right hand. So the left hand is more commonly involved.
Your concept is you are using something to strike. Then the striking hand is the right, so it should be the left. But it is only one mechanism. My point is when we are exposing something, that exposed part is tend to have more risk for injury. No? So we use the right hand, so randomly we will be exposing our right hand more. It's supposed to be like that in general. You are giving one mechanism to explain. So I think it cannot be generalized. That is also acceptable. I mean, but I don't think that is generalizable. Is there any other specific, or is there random finding that I just wanted to know?
Random finding.
Hello. Well done, Dr. Subrata. Subrata is a new MCH student in plastic surgery. I think he has done quite well. The presentation was quite good. If you collect good data, you get good papers. First, will you please tell what are your goal of reconstruction of fingertip?
First, to maintain the length of the finger, then to provide a sensate, well-bedded, pain-free skin, and to maintain the prosthesis also.
Yes, very good. So first is to provide a sensate, well-bedded fingertip, which many times we have achieved. I think that is very good. We should remember that even the blind can read because of the fingertip, because they can use the braille to read. So fingertips are very important. I think we should reduce the use of full thickness grafts because they are not full thickness either. They are neither sensate. Otherwise, a very good presentation. I wish you all the best. Thank you.
Thank you, sir.
Just one question. I saw some of the fingertips almost amputated, like it's as if amputated. Is there was no phalanges, distal phalanges involvement there in your cases? Was it?
Terminal part was transversely involved. Terminal
Was some this one cut off amputated?
yes, yes.
Did you think of any implantation done this one? Did all the patient came late or?
Actually, in all the cases, the neuromuscular structures are not properly intact. In severe crash injuries, all the neuromuscular structures are destroyed, and the vessel size is very small, like less than 0.5 millimeter in the distal part of the fingertip. So it is very difficult in such cases.
There was no chance of you doing an implantation, didn't you?
Only in a few cases we can try.
Yes.
Dr. Subrata, we have done quite a few cross finger flaps, and we did 4 or 5 cases of right flap also. I wish you had included those in your presentation. And we have also done composite graft for amputated part of the finger. Okay, so we need to improve our record keeping, especially the photographs. Anyway, we presented confidence. Thank you.
There is no more question. I would like to request Dr. Krishna to continue.
Thank you. Thank you, Dr. Subrata, for your nice presentation. Indeed, fingertip is one of the most exposed portion of the hand, and so the portion of the hand which is frequently injured. One of the most alarming trend that we find in this study is that breast injuries, especially in young children. And most of the time in children, drug plates are involved. So very recently we came across children with growth deformities of the fingers. Now another important thing is that fingers and hands, they are not about the functioning, they are also cosmetic portion of the hand. So whenever we have some defect, it draws the attention of some or any onlookers. So we always try to manage this type of injuries with some hand surgeons or surgeons specializing in hand surgery. This gives better functional and cosmetic results. Thank you.
Thank you, Dr. Krishna. Thank you.
For the next topic from the Department of Medicine, Endocrinology